Gwendolyn Gramer, Heidelberg University Hospital. Newborn screening for metabolic disorders in Germany, achievements and future perspectives.
Ladies and gentlemen, I would now like to share with you how you can save lives with a simple piece of paper. And I'm talking about newborn screening, and this targets inborn diseases which, after an asymptomatic period, lead to severe developmental impairment, severe illness, or even death. In these disorders, early detection in the pre-symptomatic period, however, allows for a preventive treatment. And newborn screening is performed with filter paper cards like these, on which blood is sampled in the first days of life and then analyzed in a screening laboratory. In Germany, the newborn screening panel includes about 12 metabolic diseases and 2 endocrine disorders. And every year, about 500 children are identified in Germany with one of these disorders, for whom newborn screening makes a life-changing difference. We could already demonstrate in a first prospective study for a newborn screening center in Europe that for almost all patients with one of our current target disorders, we can achieve normal physical and intellectual development due to the early identification. We are convinced that now is the ideal time point to perform the next step of an extension of the newborn screening panel. And therefore, we are currently performing a pilot study for the evaluation of 26 additional metabolic disorders in the newborn screening panel. The disorders are listed here, and I will not go into the details. Some of the disorders are very rare, but all of them are treatable. What's new in our pilot study is the use of so-called second-tier strategies. That means that previously we had to base our decision on whether newborn screening was normal or abnormal on certain primary parameters for every target disorder. Now, in the new approach, if we have abnormal results for primary parameters, we then analyze secondary parameters for the target disorder, which are more specific. And only after this step do we decide whether newborn screening is now normal, because also the secondary parameters were normal, or whether newborn screening is classified as abnormal because the secondary parameters were abnormal too. And only at this step do we inform the families and have to refer the child for further diagnostic workup. And by that means, we can increase the quality of our screening approach considerably. So I would like to conclude, newborn screening is already now the most successful program for secondary prevention, and I'm convinced that a considerable number of children will benefit in addition from screening for additional target disorders in the course of our study, and even more in the case of a future extension of the German newborn screening panel. And I would like to thank especially the Dietmar Hopp Foundation for the generous support of our studies, and you for your attention. Thank you very much.